This is a good question. So, comforting isn't making anything worse on its own, and there's always a time and place to give that comfort. I'm not asking you as parents to become cold towards your children, but during an exposure, you have to let them experience the fear. The way that we treat panic attacks is by exposing your child to a panic attack, and we call this exposure. And exposure is actually the most effective way to treat a panic attack. But if you're validating and comforting your child throughout the exposure, they're not actually experiencing the fear to the level that we want them to experience. It is scary, and the goal is we want their anxiety to actually max out, so to have peak anxiety during a panic attack and during an exposure to it, because this means that naturally, if we keep exposing them to what they're afraid of, the anxiety will eventually die down. We call this habituation. What you'll realize is that the more and more you expose your children to things that they're afraid of, they start to become less and less afraid. And this happens not by telling them or teaching them or validating their feelings. It happens through their own body, through their own physiological sensation. This is the strongest treatment that we have for anxiety, and you probably have experienced this yourself to some degree. This is the same reason why we might recommend for a child not to take an anxiety medication when they're in exposure related treatment, because it's going to minimize the effect of the exposure. I hope this helps, and let me know if you have any questions.